Complete New England news coverage starts right now. This is Fox 25 News at 10.
The opioid epidemic is impacting those responsible for our health care, and it's costing more nurses their jobs. Some nurses are now speaking out about substance abuse. As investigative reporter Carrie Cavanaugh found out, in some cases, nurses are stealing drugs on the job.
Nurses have dangerous, high-stress jobs. When injured, a simple prescription from their doctor can quickly lead to problems that can be exacerbated by their easy access to addictive painkillers.
I've lost a job. I've lost my children to their father. I've lost a marriage.
Dara says she became a nurse to help people. In 2006, she had some medical issues that left her the one in need of help. She was 36 years old when she got a prescription from her doctor that would change her life.
I was given prescriptions for Percocets and Vicodin. The first time I received the narcotics, it was an instant love for it. Just an immediate rush came over me.
As a nurse in the ER, it was hard to escape the source of her addiction. A year after her first pill, the hospital began to notice discrepancies in how she administered medication.
At this point, I knew that I had an illness that had become out of control.
Dara says that was the moment she knew she lost control and immediately asked for help. Her story is not unique. In 2016, 73 nurses in Massachusetts surrendered their license for substance abuse or diverting a controlled substance. That's nearly 3 times as many in 2015, according to data from the State Department of Public Health.
The number one risk to nurses is the risk for injury. That's where we see majority of the nurses getting into the issues of addiction.
Carol Malia with the Massachusetts Nurses Association works with the union's peer assistance program.
I think the more we tear down the shame and the guilt and get out and explore and let people know that the resources are there.
The program tries to help nurses struggling with addiction before things get out of control. Fox 25 Investigates examined state data that showed reports of nurses stealing powerful drugs like fentanyl from their patients. Registered nurse Marjorie Taylor had her license suspended in February of 2015. We were there in January of this year when she pleaded guilty to 35 counts of writing false prescriptions for thousands of pills of OxyContin. She received 3 years probation. She's actively seeking help for recovery.
I miss nursing. I loved it. I miss it. Most of all, I miss working with patients.
Dara says she's working to get back to her work of helping others. She says it's been a long journey as she learns how to best help herself.
A lot of things, I guess, that I thought I couldn't handle, I've learned that I can handle. I don't need substances to get through it. That's a lot of what I'm learning in this process of healing.
The Mass Nurses Association has a free and confidential hotline that struggling nurses can call. The association estimates between 200 and 250 nurses are currently in the substance abuse rehabilitation program. That's a rigorous 5-year program that must be completed in order for nurses to be able to go back to work. For Fox 25 Investigates, I'm Carrie Cavanaugh.
We have more details on this issue now. Some hospitals have increased security of powerful narcotics. For example, Mass General tells us since 2013, they've had a team dedicated to drug diversion or medication stolen on the job. They're also using enhanced surveillance, daily auditing, and training.